Hello, everyone. I'm so excited. This is a new talk for me. This is a Sexponential Medicine. Ladies, it's your turn. So welcome to all the ladies. And I also want to recognize some of the men in the audience. I think it's amazing that you're here. You're kind of acknowledging that although you don't have a vagina yourself, it turns out that you know some other people probably that do. And that you respect those people and that you want to learn more about them. So I appreciate you being here for that also. So let's get started. So we're living in this really extraordinary time, right, where we're seeing advancements in medicine as technologies from other sectors are merging with traditional medicine, and we're starting to see this exponential growth curve. And you've heard other speakers talk about this because it's something that's really big that's happening right now. And so we're kind of at the lower part of this curve right now, right? We're starting to kind of shift upwards. And just as regular medicine has sort of started this exponential growth curve, so too has sexual medicine. So I call this Sexponential medicine. It's a pretty exciting time to be alive. But before we talk about that, and I will talk about a lot of this sort of techniques and therapies and tools and cool tech stuff that I know you guys love, I want to give you a few numbers to bring you back down to earth a little bit. So 40% of women report having some degree of sexual dysfunction. That's a lot. 38%. This is the number of women who reliably orgasm during partnered sex with men. 38%. That number goes up to about 65% if you're in a longer-term relationship. That number goes up to about 85% if you're having sex with women. And by the way, that number for men is about 95%, no matter who they're having sex with. All the people. So we call that the orgasm gap, and you guys have probably heard about it. Who's heard about the orgasm gap? Yes? So I've been riding the tube around London lately, the tube, we call it that. And every time I get off the tube, the lady's like, please mind the gap. And I'm always thinking to myself, yes, why are we not minding the gap? I don't know that she's talking about the orgasm gap, but I think she might be. 50%. 50% of women in one survey did not believe that they have a G-spot. You've been told, for years you have this sort of magical, mystical spot inside your vaginal wall that you can kind of push on, and you can have these full body orgasms, right? Everyone talks about the G-spot. Well, when surveyed, half of women said, I'm not sure I have a G-spot. And in fact, in our sort of medical world, this is referred to sometimes as the gynecological UFO. Because it is much talked about and it's much searched for, but there's not a lot of objective evidence that it actually exists. Now, if there is a sensitive area, which there is in a lot of people, it's usually at the back of the clitoris that's interacting with sort of nearby structures. So the back of the clitoris interacting with the bottom part of the urethra or the vaginal wall or the Skene's glands, but it's not necessarily a spot. It's more of a zone, and it may be in different spots depending on your anatomy, and you may or may not have this special zone. So just so you know, 75% of women require direct clitoral stimulation in order to orgasm. Said another way, that means that 75% of women do not orgasm just from regular vaginal penetrative sex. Does that surprise anyone? The women are like, no, we've known this. This is not new news. But the rest of you, take notes. And then 50%. Back a few years ago, Dr. Nicole Proust did a study, and she published some interesting data. They found that 50% of women in the study reported they were having an orgasm despite there being no evidence of the telltale pelvic floor contractions that define an orgasm or a climax. So it's this very interesting question that she raised, and we actually don't know what the reason is. Is it that there's sort of more than one type of orgasm, and only some of them cause contractions? Is it that we're not educated in what these feelings are? We're just kind of making stuff up? Is it, it could be anything. But I think if you take all of these things into consideration, we're looking at a bunch of women who are dissatisfied and maybe a little bit confused. So I'm going to do a quick history lesson that may kind of answer part of why that is. So we start here in the 1500s with a French dude who shall remain nameless because he was the first person that discovered the clitoris, and he named it the shameful member. So I'm not even going to tell you his name because it doesn't matter. We jump forward to the 1900s, and you have Sigmund Freud, and he discovers that there are two kinds of orgasm. You guys have probably heard this. There are vaginal orgasms, and there are clitoral orgasms. Now, vaginal orgasms they're like the primo orgasms. And if you're mature, and you're sophisticated, and you're super cool, you're having one of those. If you are having clitoral orgasms, you are immature, you are frigid, and you probably have some kind of mental disease. And this is really what he said. I mean, I may have made some of that up, but most of it's true. He did say mental disease. So that's kind of what the thoughts were in the 1900s. In the 1950s and 60s, you have Kinsey that came out and said, he shocked the world when he actually revealed that about 40% of women's first orgasms happen during masturbation. And everyone was like, oh, they're even talking about it. And then he and also Masters and Johnson also said that it turns out that the clitoris is actually the primary source of pleasure for women, which the women for all these hundreds of years were like, yes, we knew that already. But it was actually now published in scientific papers. 1994, Jocelyn Elders. She was a U.S. Surgeon General. And in an interview, someone asked her whether or not masturbation was normal and healthy. And she said, yes. And they said, well, should we teach it to our kids? Like, that it's okay, that it's normal, it's healthy. And she said, maybe we should. So she got fired for saying that. They said, no, we can't talk about masturbation. We can't talk about it being normal and healthy. And she got canned. And then finally, 2005. Do you guys know what happened in 2005? 2005, Dr. Helen O'Connell, for the first time, published the full anatomy of the clitoris. 2005, she did MRI, she did dissections. This is the very first time that they saw the full anatomy, there she is, of the clitoris. So to kind of recap that, we just learned about the full anatomy of the clitoris 17 years ago. And we have been told by everyone from Sigmund Freud to Pornhub that sex and pleasure are supposed to look a certain way and feel a certain way, and that if you're not doing it that way, they're doing it wrong. And then, our politicians and our women have been fired for suggesting that self-exploration isn't actually that bad of a thing. And this actually, by the way, is how most women decide what works for them. They decide what feels good, right, is self-exploration and masturbation. So you have all these things happening. How are we surprised that 40% of us have some degree of sexual dysfunction? So when I talk about dysfunction, just keep in mind that I'm not necessarily saying that you're broken or that you're damaged. And in fact, most of the time, I think a lot of the dysfunction we see is because we're just not having honest conversations about what's normal and how to get there and how to implement that in our life and how to make it better. It's not necessarily a matter of our equipment malfunctioning. It's a matter of us not ever getting the proper instruction manual. So keep that in mind, the back of your mind, as I talk a little bit sort of about the more techie stuff that's going forward here in a little bit. All right, so this is my approach to sexual optimization, sexual longevity. And we'll kind of go through this here. The first part is mind the mind. Second part is boost blood flow. And then you have optimize hormones and support the structures. And in the middle, you have a smiley face, because it makes you very happy. Mind the mind. So I have a friend of mine who tells the following story. She said that she and her husband were having kind of a rough patch, and they were having a lot of problems. They weren't communicating. They were both working long hours. They were tired and kind of strung out and all of that. And then one day she came home from work, and her husband met her at the door, and he said, "Honey, I did the laundry for the entire week. I washed it, I folded it, I put everything away for the entire week. And now I want to give you a 15-minute clitoral massage." And this had never happened before. Neither of these had ever happened. So she was very shocked and amazed. And she told me later, she said, "Amy, I don't know which of those things turned me on more." The fact that he wanted to give me this long clitoral massage, or the fact that he did the laundry for the entire week. And I think that this points out the importance of our mind, of our brain, of our biggest sex organ, because especially as women, but also as men, there's a lot that's going on there. There's, if you start having stress, if you feel overwhelmed, if you feel tired, if you feel too busy, if you feel like you should be doing your to-do list, then sex falls by the wayside. We talk about sort of the brakes and the gas, and a lot of this stuff is the brakes when it comes to being interested in sex. So finding ways to mitigate that is really important. And obviously there are some amazing sort of old tools out there, like, like meditation and walks in nature, which I'm a big fan of, and journaling and all of those things. But there's also some pretty cool newfangled kind of gadgets. There's transcutaneous photobiomodulation, which was initially looked at for treating depression, but it turns out it's also helpful for improving desire and arousal. There's some different apps out there that are especially aimed for women, like Rosie and Dipsia and Furley, where they're sort of some sexy storytelling mixed with education mixed with mindfulness. There are some devices, some of which are here, like the Apollo, the Happy, the Newcom, the Sensei, like some of these things where they're getting you in a parasympathetic kind of rest and relax state, and you're doing that and using that to help get your brain ready. And then there are also the little needle there. Those are some peptides like PT141, which you've probably heard about at this point. It became an FDA-approved drug in the U.S. called Vyleesi, but it works on the melanotan receptors, or the melanocortin pathway in the brain, and it's unique in that it actually increases desire, arousal, and orgasm, not just sort of arousal like some drugs do. So that's a great drug. It only works in about half of women, but when it works well. All right, next up is boost blood flow. These are things I think that a lot of you guys know about. So, obviously your clitoris needs blood flow. Your vagina needs blood flow to have lubrication. Clitoris needs it for erections. Yes, we do have erection as well. And the best way to get that is to have nice open blood vessels. As you get older, you start getting plaque buildup. Those blood vessels are not as open, and then you obviously don't have as much blood flow. So this slide, probably the most important slide, but you guys know a lot of this stuff. The main thing is think low inflammation, whether that's your diet, your lifestyle, your stress, your sleep, all the things that you're doing, you're reducing inflammation, which is reducing the possibility that you're going to have cardiovascular disease develop, and it's going to reduce the possibility of the cells within the vaginal tissues and all of the supporting structures becoming sort of more inflamed and less likely to work. Nitric oxide, if you've ever heard me speak, you've heard me talk about nitric oxide because it's one of my favorite things. But this is the main chemical messenger that tells your blood vessels to vasodilate, which means open up. And obviously it's important for getting blood flow to different parts of our body. We make less and less of it as we get older. So by the time you're 40, you're making about half as much as your 20-year-old friends. And that gets worse and worse and worse. And it's better if you're healthy. So the blue line is people who are healthy, exercising, diet, eating well. Your nitric oxide stays up longer, but it's still going to go down after about the age of 40. So there are other things you want to focus on to keep that nitric oxide up. Exercise is easy. Nasal breathing or other breath work, like pranayama breath work and things like that, could be really effective for increasing nitric oxide. Sunlight, or if you don't have a sun, then like red light therapy, photobiomodulation is also great. Sauna, PEMF pad, some of these other hyperbaric oxygen, some of these hacks that you're seeing out there, they're actual sexual medicine hacks. They just don't tell you that. These are hacks for your clitoris. These are hacks for your vagina. They just don't advertise that, but they really are. And then nitrate-rich foods, things like green leafy vegetables, beets, citrus, things like that. They're going to be really high in nitrates. You can actually make nitric oxide from those foods, but you have to have intact, healthy bacteria in your mouth to do that. What's something that you're doing potentially that's killing those bacteria? Mouthwash, yes. So if you're using antiseptic mouthwash like Listerine regularly, you're killing those bacteria and you're losing the ability to make nitric oxide from food. So you're eating all that spinach and it's not even like doing anything for you. So avoid the mouthwash. Also want to avoid stomach acid blocking medications like Protonix, PPIs, because you need stomach acid to also make nitric oxide. All right, hormones. Dr. Jolene Brighten talked a lot about hormones. I'm not going to go into this as much, but just know that estrogen, testosterone, and progesterone are all important for this as the sex hormones in women. Testosterone doesn't get as much, press, and there's actually at least in the US, there's no FDA-approved testosterone replacement for women, even though we've known for decades that women need testosterone for all parts of the sexual response curve. So they need it for desire, they need it for arousal, they need it for orgasm, they just need it. And we start, losing our ability to make testosterone if we're taking birth control pills, or if we're over the age of 30 or 35, or if we're doing other things, if we're not lifting weights. So there's a lot of things that cause that to go low. Estrogen is going to usually be pretty high high until menopause, although if you are taking birth control pills, if you're breastfeeding, if you have autoimmune disease, if you're working out too much, if you're too skinny, there's a lot of things that you can actually do that can make your estrogen go low. And that's going to affect not just your sexual desire and arousal, but also the health of your vaginal tissue. So your vagina becomes less stretchy, less elastic, more painful, all these things. So hormones are important. I recommend making sure you're working with someone on your hormones if you have any questions about them. There's some pretty cool tests out there. This is a functional genomics test that uses artificial intelligence from the DNA company, which I don't have affiliation with any of these companies. I just like them. But this was a test that showed kind of for me that I tend to make a lot of testosterone. I don't tend to convert it into estrogen. It tends to kind of stay testosterone, which makes sense. I have sort of this straight up and down body, which is like a testosterone androgenic kind of body, versus someone who has a lot of estrogen. They have all these nice curves. What's interesting, though, is this is showing me that if you were to give me estrogen, then I would tend to metabolize it in a way that's not very safe. I would tend to metabolize it down one of the pathways that's going to give me more side effects and maybe more increased risk of problems like cancers and things like that. So you have to be very careful. So this kind of information combined with blood testing or urine salivary testing can make big differences in how we replace these hormones if we need to. And then finally, what is my time? How am I doing? You're doing great, Amy. No, I mean on the time. So I'm going till 12. What time is it right now? 12 minutes. Oh my gosh, I'm doing so good. Thank you. Thank you. I love those sex jokes. Okay, so pelvic floor strengthening. Raise your hand, you don't have to, but raise your hand if you want to if you're holding in your stomach right now without thinking about it. I'm always holding in my stomach without thinking about it. I just realized this recently. I'll be sitting in bed, reading a book at night, and I'll think about it and be like, oh my gosh, I'm still holding in my abs. I'm still holding in my stomach. I'm so used to doing it after just years of just kind of being told, hold in your stomach. But this is really important because the pelvic floor can be affected by something as simple as holding your abs all day, or sitting all day, or not standing properly, or lifting weights the wrong way, or doing yoga the wrong way, or just having some kind of chronic pain in your hips or your back or your pelvis. The pelvic floor, people think about these pelvic floor muscles, which kind of make a hammock that support your vagina and your uterus and your bladder and all of that, right? They think of them as being like a scaffolding. So then they are sort of, they're holding up those organs. But they're actually active. They're not just sitting there. So these muscles are important. They help to bring blood into the clitoris. They're like ushering the blood in when they're strong. They're helping to keep the blood there so that when you have an erection, a clitoral erection, that it stays. So if you have weak muscles that are loose and weak, you actually don't get the blood flow that you need. Did you guys know that? I know, it's so fascinating. And then, of course, you need the muscles for orgasm. So they contract during orgasm. And so if you have loose, weak muscles, like you had a baby and you haven't done your Kegels, then those muscles can get weak. And that can affect your pleasure, it can affect your orgasm. But some people actually have tight, weak pelvic floor muscles. And this is important because Kegels in that group is actually what you don't want to do. It's the opposite of what you want to do. So those muscles are really tight and they don't know how to loosen up. And the things like holding in your abs all day, not breathing properly, sitting all day, all of that can contribute to tight, weak pelvic floor muscles, which is something that you need to know about so you can relax them and not do the wrong exercises. So that's something you can see a pelvic floor therapist for, and it's pretty simple. You heard Dr. Adels, my partner, Harry, talk yesterday, and I don't know if he's here. He's over there. He's one of our few men. Thank you. And he and I do stem cell procedures. We use stem cells from the patient. We use PRP. We use the VSELs, the new kind of stem cells in blood, and inject those things into the genitalia. So I inject them into the anterior vaginal wall, where the sort of mythical, magical G-spot may or may not be, and into the clitoris also. We usually do this, either with topical numbing cream or patients are just asleep. But the idea behind this is to get these cells to communicate with your body, with the cells that are already there, to tell those cells, hey, let's become a little bit more active. Let's make some more blood vessels. Let's make some more collagen. Let's make some more, kind of rejuvenate these tissues. And we often see improvements in sensation, improvements in blood flow, improvements in ability to have orgasms and pleasure with these simple little, injections with a small needle. So other things that we can do, this is, and it's a penis, this one over here. I know it seems like it's in the wrong place, but it's actually not, because this shockwave therapy, which has become very popular for men in the last, we've been doing it for about 6 years, may have a role in women as well. The idea behind this is we're using high-intensity sound waves, applying it to the tissue, and then we start to see recruitment of stem cells. We see nitric oxide production. Oh, really 10 minutes this time. That's great. I'm going to be good. We see improvement in nitric oxide, which we now all know about, with shockwave therapy. So there's some applications in women that we're starting to at least try it and seem to be having some good results with that, just doing external, like vaginal, like vulva treatment and clitoral treatment. And then we have some different vaginal lasers and radiofrequency devices that we can use in the office, depending on kind of what the problem is, if it's lack of lubrication or sensation or stress urinary incontinence, that can be helpful. All right, and then it wouldn't be an effective talk without some homework for you guys. So these are all things you can do at home. And again, I have no affiliation with these companies. There are other ones out there, but here's just a couple of examples. If you have a loose, weak pelvic floor, or like a normal pelvic floor, but not a tight one, then something like these TENS units, which are intravaginal, could be helpful. That goes inside. It causes your muscles to contract. It's kind of like Kegels on steroids. They can be very effective. It's a lot, guys. It's a lot. Has anyone ever in your mind, have you guys used these? But because it really is like a whole thing. There's also some external devices that you can put outside. Does the same kind of thing. Causes those muscles to contract. And then there are the gamified Kegels, which are really fun. These are devices that you put inside, and then you have your phone, and then you're essentially doing Kegels, and you're watching it on the phone, and the phone, like the little frog is jumping. By the way, I mentioned Frogger to my kids a few days ago, and they didn't know what it was. And then they were like, "You mean Crossy Road?" And I was like, no, it's Frogger. It's like a thing with the frog that crosses the road. He's like, yeah, that's Crossy Road. So apparently Crossy Road is what it is, but this is what you're doing with your vagina. And you can challenge your friends to contests, and you can keep score. It's, okay. Vaginal, intravaginal red light therapy is also nice. This is a wellness device. It's very safe. And it's just applying that red light therapy photobiomodulation concept to your vagina. So this is goes inside, kind of vibrates. There's a little warmth, a little heat. It's quite lovely, and you get increased ATP production by your mitochondria in the vaginal cells. You get improved lubrication, you get improved sensation, and just kind of makes you feel good. It's just like a nice feel-good, hot stone massage for your vagina kind of thing. And then, if you're doing all these things, how do we know what's working if you're not tracking your orgasms? So this device by Lioness came out a year or two ago, and it's basically a way that you can track your orgasms, and you can track the strength of them, you can track the timing, you can take little notes and get an Excel document and be like, what did I have for dinner last night that caused that to be so good? And it's kind of fun. What I like about it is it's been really hard to track or to look at female orgasm, because everything's happening inside. Versus with men, there's all kinds of studies on what's happening, because you can just look at them and but we're so much trickier. So I like that we're starting to look at that. This is a company in the decentralized science space, or Web3 space, that I am involved with. It's called Reputable, and they actually are just launching this weekend. They're going live. But it's a way to be able to input your own kind of health experiments that you're already doing, and to be able to get rewarded for those things. And then you can also go in and you can join someone else's health experiment. So, does this 5 minutes of cold shower affect my serum testosterone level over 30 days? Or if I'm having an orgasm before I go to bed, is that helping my REM sleep on my Oura Ring, over this time? And we're going to pool the data and eventually take that N of 1 data, aggregate it, and start helping to make decisions about what's actually working and what's not working. So check out reputable.health. It should be live, and you guys can easily sign up and do some experiments and start getting paid for that. There's one. Okay, last couple of minutes here. This is kind of, big picture, all the things together. And basically, you just kind of have to focus on all of these things. A lot of this is preventative. So a lot of you guys are young, you're healthy, you're like, my sex life is so great, it's never going to be a problem. Just make sure you're doing the right kinds of things so that you don't start to develop problems later. And if you are already having problems, these are some strategies to start looking at to try to help fix them. Before I wrap up, though, I think it's important. This is all really cool stuff. I love it, love it. But Sexponential medicine is about a lot more than all the fun tools and the cool tech, right? If we're actually going to see that exponential growth in sexual medicine and in sexual pleasure, then we have to start talking honestly and openly about sex and sexual health in women, and not just in men. Yes? We have to, teach our kids the difference between the vulva and the vagina, and maybe our boyfriends, and maybe like anyone we meet. Because I still don't think everyone knows that. We have to, start talking about self-exploration, self-pleasure. Like we talk about masturbation. It's not actually a 4-letter word. It's actually really important for us to be able to learn what we like and what feels good and what doesn't feel good. And finally, I think it's really important that we as women start to take ownership. Like, take it upon ourselves, take ownership to rewrite that faulty instruction manual that was handed down to us by generations and generations and generations of mostly men who really did not know a damn thing about our bodies and our minds when it comes to sex. You guys are with me on that? Okay, let's do that. All right, thank you guys so much.